excited today to announce $21 million in transformative initiatives between the Mayor, Boston Public Health Commission, and BPS. We're going to get started with Paul Kennedy, who is the head of school for Lee K through 8.
Good morning, all, and welcome to the Joseph Lee K-8. Thank you so much for being here. We are honored to host this press conference today. I would like to extend a warm welcome to Superintendent Skipper, Mayor Wu, Dr. Ojikutu, Dr. Simon, and everyone here today at the Joseph Lee School supporting this very important announcement and initiative. As the school leader here at the Joseph Lee K-8, I am so fortunate to be part of such an amazing community. Each day, I have the honor and privilege of working with incredible students, staff, and families in creating the future that we all deserve. A future where we are seen, heard, and valued for who we are and given all the supports we need to be our best selves. However, there is still so much work to be done on this front. During a short time, the Lee community has had multiple high-impact incidents highlighting the need for robust supports in our schools. These investments announced today will allow us to build a resilient community and empower our school social workers with the skills they need to support during hard times in a trauma-informed manner. With that, I'll pass it on to Dr. Bisola Ojikutu, Commissioner of Public Health for the City of Boston and Executive Director of the Boston Public Health Commission. Thank you.
Thank you. Thank you. Good morning, everyone. I want to start by thanking Paul and thanking Mayor Wu and Superintendent Skipper and everyone for being here today. I especially want to thank our very supportive city councilors, Councilor Tanya Fernandez-Anderson, Councilor Weber, Councilor Santana, and Councilor Louis Jean for joining us today. I also want to thank UMass Boston Chancellor Marcelo Suarez Orozco, Franciscan Children's President Dr. Joseph Mitchell, and CEO of Flourish Agenda Dr. Sean Jin Wright for their partnership in this effort. I think we're all aware that our youth are in crisis. They need our help more than ever before. According to the Health of Boston report that we will be releasing later today, many young people in Boston are struggling with their mental health and well-being. More than 40% of BPS high school students report persistent sadness and hopelessness. An increasing number of our high school students have considered and even planned suicide. And among our high school students, our young girls and our LGBTQ youth have reported higher rates of suicidal thoughts than other students. And unfortunately, less than half of BPS high school students report that they received the help that they needed when they faced mental health challenges. That is not okay, and we can and must do better. Clearly, there's an unmet need, and we need to ensure that our young people are both physically and mentally healthy. So today, we are announcing that the City of Boston is investing $21 billion to increase access to mental health services for our youth and families. These funds will be used to develop and train a more diverse behavioral health workforce to provide culturally responsive and linguistically appropriate mental health services in our schools. The funding will also be used to reduce the stigma surrounding accessing mental health services and to train youth in behavioral health careers. Over the next 5 years, this investment will do a number of things. We'll support more than 600 people in pursuing behavioral health careers in Boston and provide more than 1,000 people with behavioral health training. These efforts will involve 21 BPS schools, and we estimate that 50,000 BPS students will be served. In addition to working with BPS, we're also working with the Children's Services of Roxbury to support early childhood mental health and development. Over the next 4 years, this includes training family partners, nurses, social workers, and caseworkers, and providing services for more than 200 children, screening about 2,000 families for social and emotional wellness, and referring them for services. In addition to BPS and our partners, I think it's important to thank our team at the Boston Public Health Commission for all their hard work to make this happen. Specifically, I'd like to thank our Child, Adolescent, and Family Health Bureau, led by Dr. Uchenna Nduluwe, who's here. I'd like to thank our Health of Boston team. Please take a look at the report that I mentioned. It really has some good information about where we are, and hopefully we'll be able to tell you where we are in the future. That's going to be in a better place eventually. And I want to thank our Chief Behavioral Health Officer, Dr. Kevin Simon, and Samara Grossman, the Director of our Center for Behavioral Health and Wellness at Boston Public Health Commission. I am so grateful for all the work that has gotten us here today and look forward to what this investment will mean for our youth and families throughout Boston. So I'll turn it over to Dr. Simone to talk about the investments in greater detail.
So good morning.
Good morning.
Awesome. So thank you, Dr. Ojukutu, Mayor Wu, and city councilors that are here. I'm honored to be here and highlight the substantial strides and efforts we're making to address the ongoing crisis. And as a practicing child and adolescent psychiatrist, I am deeply involved in the lives of young people and families who urgently need our mental health support. I have clinic later today. My work allows me to actively engage with them, providing a firsthand perspective on the challenges they face. And over recent years, it's become increasingly clear that our educational systems are also feeling the strain of carrying a significant portion of the emotional burden. To bridge this gap, it's essential to understand that the programs and services we're investing in not only are immediate support, but also lay the groundwork for enhancing our capacity to change the system. These efforts are aimed at enhancing our capacity to provide long-term and effective support for our students. In this spirit, I want to extend my gratitude to BPS and the team at the Center for Behavioral Health and Wellness within the commission, specifically Director Samara Grossman, who moonlights as a BPS mom to 2 beautiful daughters, Morgan Chen, our policy strategist, and Stephanie Santizo, who keeps us all aligned, who herself is a BPS graduate, for their tireless work and dedication to this cause. These initiatives focus on several critical priorities, each designed to address a unique aspect of the crisis. Firstly, the current shortage of behavioral health providers and the need for greater diversity is crucial. Our strategy involves recruiting and training a diverse workforce, individuals from various ethnic backgrounds, orientations, and life experiences. Providers who mirror the communities they serve can significantly reduce the barriers and stigma associated with seeking support. We're grateful to UMass Boston, led by Chancellor Marcello, for their dedication to recruiting individuals across the color and identity spectrum, and for their efforts to broaden mental health counselors and therapeutic mentor certification. Similarly, I thank Franciscan Children's Hospital, under the leadership of President Dr. Joseph Mitchell, for offering advanced training in behavioral health and integrating early career clinicians into BPS schools. These initiatives have already begun bearing fruit. There are 39 students enrolled in the UMass program and 9 clinicians from Franciscan Children's placed into BPS schools. And thus far this academic year, they've been positively impacting around 230 youth. So the fruit is already being borne. In this close collaboration with BPS and Flourish Agenda, under the expert leadership of Dr. Sean Ginwright, we're excited to announce the launch of an innovative pilot program next month. We'll collaboratively examine BPS policies and system of care practices to strategize better, more equitable healing systems and therapeutic spaces for our students. This initiative is specifically designed to more effectively address and provide support for the complex trauma experiences that our students face on a daily basis. And finally, we are dedicated to destigmatizing mental health by listening to our communities that have been bearing the brunt of these challenges and sharing our available resources. This includes providing behavioral health training for people who work with youth, from school staff to community organizations to city workers, and even the youth leaders as they interact with their peers. We're looking at innovative, practical, and public health-oriented ways to these things that we're trying to do through an anti-stigma campaign, education, communication, and even art. And we'll share more in the coming months. These priorities encapsulate our comprehensive strategy to confront the mental health crisis facing our youth, and I'm excited about the progress we've made and the path that lies ahead. Thank you for your attention and support in these crucial efforts. And now I'm going to pass it on to Superintendent Mary Skipper of BPS.
Good morning. What a wonderful day for BPS, for the city of Boston. I want to begin by thanking our mayor, who just is such a champion, but always brings together the agencies and the partners that make a difference to our youth. Today, we're really seeing the village in action. You know, the Boston Public Health Commission, alongside UMass, alongside Franciscans, Children's, really coming together in a way to make a difference for our young people. I don't think it's any secret that in the pandemic, post-pandemic, our young people are struggling. We just met with a group of young people who are so articulate about what they need, what they get, what they don't get. And they were genuinely excited to hear that some of the services they get with their social workers, even with their teachers, today is an announcement where more Boston Public Schools and all BPS students will have access to that. And I couldn't think of a better celebration. This really exemplifies when we talk about comprehensive behavioral health and a plan. This is the steps toward that. This is talking about building a pipeline, which we desperately need, with a core that is cultural competent. It speaks to direct service. This will really mean that 50,000 students will, in essence, have additional direct service. It also means that we will begin building a core of an additional 300 that will come from university services and students, as well as from teachers. One of the things the young people said today was, you know, who do I go to when I'm struggling? And you heard some of the statistics about how our young people are struggling, serious ways, life, death sometimes. And they identified people who care, people who are competent, people who know what to do for them, and that includes our social workers, that includes our teachers, and this grant and this coming together of this collaboration will speak to training so many more professionals so that at day's end they're here for our children. And that's the best outcome that we could ask for. It is my privilege to introduce our mayor, Mayor Wu, who truly is a champion, and without her, BPS would not have these essential services. Mayor Wu.
Good morning, everyone. It is always an honor to be in our BPS schools, and especially today for an important announcement and conversation about report back, if you will, because in some ways this is the beginning of a major collaboration and initiative that is going to have deep impact, but it's also it's also taken a long ways to get to this point, starting with action from Dr. Basola Ojukutu and the team, and even creating for the very first time a chief of behavioral health position for the city of Boston, which we're so grateful that Dr. Kevin Simone had stepped into, and then many roundtables in community, listening to understand what the needs are, to craft the proposal that we would then ask for blessing from the Boston City Council to fund fully. And this is a little bit unusual of how Boston has used our federal recovery dollars. In a lot of cities around the country, it was used to plug holes or fill gaps temporarily. We've really been trying, with the leadership of the City Council, to show that more is possible with those dollars, not just try our best to put Band-Aids on situations, but build new infrastructure, demonstrate what works, what's possible, so that we can keep moving forward. And the announcement today really shows that Boston sees critical infrastructure not just as roads and bridges or even things that you can touch and see, but as people, as mental health, as the workforce that cares for those who are in need of services. And so I really want to thank City Council President Louis Jean, who had to leave to prepare for City Council, the official meeting, which starts in a little bit, and colleagues on the council, Councilor Fernandez Anderson, Weber, and Santana, for your steadfast leadership and commitment to keep pushing for even more for our young people and for our communities. This is typical of how Boston makes a difference, is that we stand together tackling longstanding challenges with new approaches through collaboration. And the folks who are up here are an incredible group that I'm honored to work alongside, but I wish the cameras could see the folks who are over here who really are changing our world and focusing on our young people every day, whether you're primarily wearing the hat of an educator within the Boston Public Schools. I want to recognize Interim Chief of Students Corey McCarthy, for example, Jenna Parafinzik, Director of Social Work, Superintendent of Region 6, Efren Toledano, and many, many others from BPS. Whether you're wearing a primary hat from the perspective of our Human Services Cabinet, Chief of Human Services Jose Masso here and many of his team members, whether you are here as a public health or healthcare professional working and supporting Dr. Ojikutu and their team, whether you are here as a faith leader who maybe provides the most important and deepest sense of comfort and support. Thank you, Bishop Dickerson, for all that you do for our city. Or you're representing one of our partner organizations, UMass Boston and dropping pens all over the place, UMass Boston and Franciscans and many of our other partners. Thank you to Head of School, Kennedy, for having us here. I won't add, he's dressed sharply for the occasion as his students and everyone keep mentioning, because he is such a steadfast rock for this school, and so we're so grateful for your leadership in these 2 years and for all that you've done for our district and our system over decades of being in education. I also want to shout out Rosie Kanan, who is a social worker here at the Lee. So thank you for your commitment to students and families. And then I'll just again echo for Dr. Samara Grossman and Uchenna Indulue. Thank you for all that you do in BPHC. Much has been covered about what we're trying to do and why, and so I'm just going to skip through to my notes to make sure to shout out all of the universities that are part of our partnership, or all of the community organizations part of our partnership: UMass Boston, Boston University, Brown University, Franciscan Children's, the Flourish Agenda, and many other community partners, thanks to the City Council's leadership with the American Rescue Plan dollars. The U.S. Department of Education, and SAMHSA, the Substance Abuse and Mental Health Services Administration. We are trying to do something where we recognize the gaps that community members have made very clear exist. And in the roundtable that the superintendent and Dr. Ojikutu and Dr. Simone and I were able to participate in earlier, I felt in some ways taken all the way back to before I ever thought that I would be in politics as well. As someone growing up in an immigrant family, very aware of all the many stresses and challenges and barriers that a family can face, and then the mental health challenges and gaps on top of that. Even in a city like Boston, where we are the healthcare hub and leader of the world, our residents do not always feel and are not always able to access these world-class services that are right here in our city. And it's about building those connections and empowering and investing in our community to be able to be reflected fully in all those spaces. For our young people to know that they can access that not by going downtown, far away from where they might live, but right here in their school buildings. To have the spaces for comfort, for support, for community building everywhere that they're interacting with their city. And so this is a major investment in the workforce that will be caring for those who will be leading our communities. And by putting our dollars directly into making sure that a workforce that reflects our communities, that is dedicated and devoted to staying in Boston and making a difference right in our Boston Public Schools, thanks to the training of the world-class institutions we have around us, this is going to be a model for the rest of the country and certainly will make a difference for generations to come. Before I turn it over to our most important speaker today, Leila Martinez, who's going to come and share a little bit of perspective from the Lee School, I want to make sure that some of what has been described so far is summarized and that we are making sure that our Spanish-speaking residents get the information too. Entonces, gracias a todos los líderes aquí. Estamos aquí para empezar reconociendo que no estamos en un momento fácil. Es difícil ser consciente de todo lo que está pasando, estar en contacto con el sufrimiento de tantas personas, ya sea en el otro extremo del mundo o en el otro extremo de la ciudad. es cansado y por supuesto el momento actual llega tras algunos de los años más difíciles y aislantes de la historia reciente. Así que tiene sentido que todos estamos viendo y sintiendo impactos de largo plazo en la salud mental. Y vemos que estos efectos afectan de forma desproporcionada a nuestros jóvenes. Como mencionó, ha habido un aumento significativo en el número de jóvenes que dicen sentirse tristes, ansiosos, vacíos, enojados o desesperanzados. Y sabemos que los jóvenes de color, las mujeres jóvenes y jóvenes LGBTQ+, lo están pasando aún peor que sus compañeros en lo que respecta a la salud mental. Justo antes de esto, tuve el privilegio de asistir a una mesa redonda con algunos de nuestros estudiantes de las escuelas públicas de Boston y la doctora Ojikutu, Dr. Simón y Superintendent Skipper. Quiero dar las gracias a todos los jóvenes que han participado por su valentía y vulnerabilidad y por estar dispuestos a compartir sus experiencias con nosotros. No son los únicos que se sienten así y a participar en esta conversación nos ayudan a apoyar mejor a otros que están pasando por lo mismo. Así que gracias por ayudarnos a cuidar mejor de todos nuestros residentes. Sabemos que hay medidas claras que podemos tomar para hacer más por los miembros de nuestra comunidad que tienen problemas de salud mental. Por ejemplo, en este momento simplemente no tenemos suficientes profesionales de la salud mental y conductual para satisfacer el nivel de demanda que estamos viendo. Y de ellos, el número de los que tienen la formación y la competencia para trabajar eficazmente con los jóvenes, con independencia de su raza, idioma, sexo, orientación sexual y creencias religiosas, es aún menor. Eso sin mencionar la falta de un marco más amplio a nivel de todo el sistema que garantice que los alumnos, las familias y el personal de las escuelas públicas de Boston reciban una atención de máxima calidad. Por eso hoy, para cambiar esta situación, estamos realizando una inversión de $21 millones en nuestro personal de salud mental, desde mentores terapéuticos y trabajadores sociales hasta psicológicos, trabajadores comunitarios y consejeros. En colaboración con UMass Boston, Boston University, Brown University, Franciscan Children's, Flourish Agenda y Sociedad de Comunidad, y gracias a la financiación del gobierno federal y aprobación del Consejo Municipal, también el Departamento de Educación de Estados Unidos y la Substance Abuse and Mental Health Services Administration, SAMHSA, estamos invirtiendo en las personas que cuidan de nuestros jóvenes y estamos creando más y mejores oportunidades para que los jóvenes exploren carreras en salud mental. El canciller Marcelo Suárez Orozco y el Dr. Joseph Mitchell compartirán más información sobre estas asociaciones dentro de un rato, pero quiero terminar diciendo que de todas las cosas que hace la ciudad, nada es más fundamental para nuestro trabajo que el bienestar de nuestras comunidades. Cuando nuestras comunidades sufren, cuando nuestros residentes no están bien, esa será siempre nuestra máxima prioridad, porque todo lo demás solo empieza a importar cuando nuestras comunidades están lo suficientemente sanas y felices como para aprovechar al máximo todos los demás programas, servicios y recursos que ofrece el gobierno municipal. Así que quiero dar las gracias una vez más a todos por estar hoy aquí, por dedicar tiempo y espacio a este anuncio y a estas conversaciones y por hacer posible la inversión de hoy. No hay nada más importante. Gracias. Okay, so I'm going to introduce Leila Martinez, 8th grader at the Joseph Lee K-8 school, who will be followed by Chancellor Marcelo Suarez Orozco and Dr. Joseph Mitchell. Leila.
Good morning. My name is Leila Martinez, and I'm an 8th grader here at the Lee School. I would like to introduce the UMass Boston Chancellor. Everyone goes through different things and deals with it differently. I think about this time my mom and I saw a man who looked like he's going through something. I tell my mom about it, and she tells me to never judge a book by its cover because that could be you. I nod my head and think about what she said. Later on, I asked why she said, "Never judge a book by its cover." My mother said, an outward appearance of something or someone is not an indication of its value or worth. People go through things that they don't talk about, and that's why they are in the position that they are in. I asked my mother, "Have you ever went through a situation like this before where you had to deal with that?" And she said yes. And that is why she's humble the way she is now. I share the story because everyday students come to school going through something that they don't talk about. Sometimes they don't have anyone to talk to, and other times they don't feel safe to share with certain adults. So they just bottle it up inside. This can make us feel anger, anxiety, and can lead to depression. What we need is encouragement to share our story. We need adults that can make us feel safe and will listen when we talk about our challenges. We need people like Miss Rose. Before I met my social worker, Miss Rose, I was one of the students who bottled up my emotions. I didn't think I needed someone to talk to, but I did. When I first met her, I knew that she was a person I could trust because of her personality, the way she is honest and kind. Since working with Miss Rose, I have been a better person mentally. I am better at focusing on school, I am better at dealing with frustration, and I am more patient with others. Students also always need someone to talk to them, even if it's just a checkup, because for me, a little bit goes a long way. We need adults who will listen and understand our story and not judge us by the cover we come to school with. Thank you for listening.
Good morning. The kids are not okay. Los jóvenes no están bien. Mayor Wu and the Boston Public Health Commission have presented UMass Boston with an exceptional opportunity to expand the behavioral health workforce in our beautiful city of Boston. First, I want to thank our mayor. A+ in your pronunciation, grammar, and general delivery. A+. Dr. Bisola, it is such an honor to be here with you. I'm so delighted to also join here with Dr. Kevin and, of course, our extraordinary superintendent, Mary Skipper, Dr. Joseph Mitchell, and, of course, our good-looking Joseph Lee, principal of the Joseph Lee School, Mr. Kennedy. I got to get me a tie like yours. Beautiful. Transforming Boston access to mental health is a project the university is engaging with ganas, with gratitude, to deepen our partnership with the city, and in this case, very specifically, to recruit, train, retain, and place 263 of our students in the behavioral health positions in our city of Boston. The kids are not okay, and we need to step up to get in front of a once-in-a-century set of formations that have created such despair, such sense of hopelessness that our doctors have so well articulated. Consistent with our mission to be Boston's anti-racist, health-promoting university, this project will address the growing need for mental health resources among our minoritized and marginalized youth, particularly addressing the existential matter of shortage of mental health providers with identities that reflect the lived experiences, the beauty, the strength that our students bring to our classrooms, to our city, day in and day out. We share the Commission's goal to advance racial justice, health equity. Racism is the other mental health crisis in our country. We need more accessible behavioral health services. We need to prepare cohorts of culturally, linguistically, and racially diverse providers to become human service and mental health providers with a heart, with a soul, with all the knowledge they need to better serve the extraordinary folk like our Layla, who just spoke to us a minute ago. UMass Boston offers high-quality accredited certificate and graduate programs in behavioral health fields. And we are confident that under the able leadership of PI Amy Cook and co-PI Lindsay Fallon, two faculty members with vast experience as practitioners, as scholars, the grant will enable UMass Boston to bolster positive youth behavioral health and outcomes in our city. On the strength of these existing resources and together, our community, with our community partners, we will develop the collaborative infrastructure, the collaborative ethos, the collaborative models that can be sustained beyond the funding period to address behavioral health pipeline challenges now and moving forward. UMass Boston is your city's premier public research university. We're proud to be the most diverse campus in New England and the third most diverse campus in our country. We are proud to serve the public through distinguished, meaningful, relevant scholarship, dedicated teaching, and engaged service. We are grateful for the opportunities to be a partner, an indispensable partner for advancing Mayor Wood's vision. Muchas gracias.
Thank you very much. My name is Joe Mitchell. I'm the president of Franciscan Children's in Brighton. I will keep my remarks short and in English, but I'm delighted to be here to celebrate our partnership with the Boston Public Health Commission and the Boston Public Schools. I'd like to first acknowledge a few people. First, thank you, Mayor Wu, for your extraordinary leadership, your steadfast commitment to supporting the cause of pediatric mental health, and helping us expand the workforce and diversify the workforce. We're so grateful. Thank you to Superintendent, to the Commissioner of Public Health. Thank you to my good friend, Dr. Simone, for his, he's a colleague and a friend, for his unwavering support and really visionary leadership for what this community needs at this point in time. I'd like to also acknowledge Kristen Bagley-Jones, who's in the back, who's our fearless executive director of our school-based programming at Franciscan Children's, as well as Christy, who's our on-the-ground clinician here at the Lee Schools. I'll say more about in a second. For those of you who don't know Franciscan Children's is a nationally recognized pediatric specialty healthcare provider offering mental health, rehabilitation, surgical, and educational services to children in the community in Boston and in New England. We, as of July of last year, we are a sister hospital of Boston Children's Hospital, which is a wonderful and internationally recognized leader in pediatric healthcare. Franciscan is the only dedicated pediatric rehabilitation hospital in New England and one of the largest pediatric behavioral health providers in the state, with over 20,000 mental health visits last year. This is a proud moment for our institution and for our community. On behalf of our team, I could not be more proud to be a recipient of the Expansion of Behavioral Health Pathways grant. Every day we face the reality of the pediatric behavioral health crisis, which has been compounded by funding gaps and workforce shortages. And the need for creative solutions and public-private investment and partnership could not be greater. So I applaud the city and the Public Health Commission for their creative and innovative efforts. I also want to recognize Samara Grossman, who's been a wonderful partner to our institution on this journey. You've heard it from some of the other speakers today, but a few sobering facts. 1 in 5 children in this country suffer from anxiety and depression. Emergency visits for suicide attempt went up 50% for some populations during the pandemic. The commissioner said it eloquently that nearly half of kids report that they feel persistently sad or helpless or hopeless. You know the expression, Houston, we have a problem. Well, Boston, we have a problem. And as the chancellor said, the kids are not okay. We are in the middle of an epidemic, and we risk losing a generation of kids. But there is reason for optimism and hope. First, there are people like Layla who give us inspiration and let us know that the future is very, very bright. Another reason for hope is our program, the Children's Wellness Initiative, which for over a decade has provided counseling and psychiatry services in the Boston Public Schools, embedded. School-based mental health services meet children where they are and provide a critical access point for families who would not otherwise be able to receive services. We know that our program reduces emergency department visits, helps family manage crises, and gets kids back on track. In short, through our collective efforts, we are saving kids' lives. As a result of this grant, Franciscan Children's is expanding our footprint to provide more services on the ground in Boston schools. We're standing here, obviously, at the Lee School, where, thanks to this grant, we were able to add a full-time clinician this fall, and we hope to grow the program here and deliver vital services to these wonderful children who are students here. The grant has also allowed us to add 6 additional schools to our portfolio and provide nearly 200 students with in-school behavioral health services. We plan on adding 4 more schools to our footprint, which will bring us to 22 Boston Public School sites over the next 2 years. Without this funding, we simply would not be able to expand our program. Thanks to the investment of the City of Boston, we are also working to recruit, retain, train, and inspire the next generation of behavioral health professionals. Over the 3 years of the grant, we will be able to train more than 180 students across different behavioral health disciplines, while also working to diversify the workforce and provide culturally competent care that reflects the kids in this community. So in closing, thank you again for this generous investment. We know this partnership will save lives. We know it will have a tremendous impact on the community for a generation to come, and we're so proud to be a part of this journey with you. Thank you.
Okay, I think that's everyone. So we have just a few minutes for questions on topic.
I have a couple questions about the report, the mental health report. So the report has data up to 2021. Do we know how things are looking since 2021, whether those trends have continued or changed at all?
So there's always a bit of a delay with data, and we're working on looking at 2022. So we will have that data, but the 2021 data, I think, is pretty reflective of what we're seeing, which is that we've seen an increase sort of during the pandemic and post-pandemic of these feelings of anxiety, hopelessness, sadness, particularly amongst our youth. And it would not be surprising to me if that trend continues, but it's investments like these that will hopefully, sort of decrease that trend.
And there was also data about leading up to the pandemic and like the 4 to 5 years before the pandemic. So obviously the pandemic was a big cause of mental health exasperations, but based on the report, what are the main reasons for increases in sadness and anxiety?
Well, the data actually starts at 2015 and goes from 2015 up to 2021. And as I mentioned, across not just youth, but it actually includes adult data also, there have been increasing trends, as I mentioned, of sadness, hopelessness, anxiety, as well as suicidal thoughts and behaviors that are very concerning. What we also do in the data is we provide information regarding access to services and support needs. And I think that is a concern that I tried to highlight when I was giving my comments, in that a lot of students don't feel like they have the support that they need. And this trend, it didn't just start with COVID-19. This is something that preceded COVID-19 and has been exacerbated. And I think, again, that leads us to what we're doing here today, announcing this investment in this intervention that will hopefully impact many, many BPS students and beyond.
I just want to get clarity. Were you saying that the funding we already have, or the City Council still needs to approve?
How much came from ARPA?
So it's 21 minus 4, so it's 17.
Okay.
Thank you. So the council last year already voted to approve the $17 million that came from ARPA, and then there's another portion that's matched by some of the other entities that were described.
On the report, to what extent the things you found in it do you attribute to like school closure, particularly for the entire year, if you threat closing the schools, to see what stuff is the case?
Well, I think that's a difficult question to answer. I mean, we were certainly in the middle of an emergency, and I think decisions are always made in the middle of an emergency to address the needs at the time. What I can say is that during COVID-19, we all experienced senses of isolation, being removed from our normal social surroundings, our social networks, and that has had an impact. It's had an impact on adults. It certainly had an impact on our children. So, I think that this is important for us to recognize, and to recognize that it's not just one intervention that's going to solve this. We have a lot of work to do, and it's going to continue for many years to come to ensure that our children are mentally healthy and well.
I would just add to that I think we know that in the pandemic itself that there was a disproportionate impact on our community of color, and that is who we serve in the BPS. And so ongoing issues around, homelessness, poverty, things like food insecurity, those are all still there. And in some ways, the pandemic exacerbated them. I also think that there's a lot of studies right now about social media impact on our young people, and how much time they're on social media, and how the social media actually can cause more isolation or negative feelings, particularly for our young females. So I think we're to learn a lot more about this, but the good news is that this is a huge step in behavioral health that we have not had in a comprehensive way. So we're very grateful for the resources.
The report also includes pretty granular data and breaks things down by demographic and even neighborhood. Why get into those sort of like nitty-gritty details, and how do you hope that information gets used in this program?
Yeah. So in reference to the report, it's based off of the YRBS, or Youth Risk Surveillance, which is done biannually. And in reference to why certain neighborhoods, within Boston, certain pockets are selected to be representative of the larger community. So that's why the granularity, because sometimes our communities want to recognize that their voices are being heard, so we ensure that they know.
Last question.
Thank you, everyone. Thank you.
Oh, picture.